Welcome to Planetary Health First, Mars Next. It is going to be an amazing journey today. Hope you are ready for liftoff. We are live now.
Well, man, this is an awesome day. Welcome to Planetary Health First, Mars Next. We have an amazing guest, special guest, Reva. And Reva, could you just introduce yourself a little bit? I know you're pretty well known in digital health, engagement, platforms, et cetera, and what you've done. But just for our audience can know a little bit about you, if you can just introduce yourself, please.
Yeah, absolutely. And first of all, thank you so much for having me. And I'm glad I don't have to follow up after John Gorman. I saw him last week, so I'm glad there's a buffer between. That's a big act to follow, but excited to be here. Thank you. My name is Reva Sheehan. I'm the Senior Director of Customer Insights at mPulse Mobile. We are a digital health engagement organization. We've been around for a little over a decade. We work with over 200 organizations exclusive in the healthcare space. On our platform, we generate just over 1 billion conversations annually. So my role in customer insights here, and my background prior to this, I've been here for about 3 years. I spent 8 years at a health plan in Part D operations and Medicare quality. So spent a ton of time working directly with members and individuals, helping make sure that the services and the benefits that the health plan designs for them gets into the hands of the right users. So a lot of the role that I play here at mPulse is kind of a conduit between those two. So I work with our direct go-to-market teams. I work with our selling teams, our account teams, and really help kind of bridge the gap between, digital engagement organization and health plans as our primary customers. So I spend a ton of time reading and keeping up on regulatory documents. So, CMS just released the 2025 advance notice last week. So I'm still picking through that. So I'm really just kind of making sure that all of the items, the things, the measures, the requirements on the health plan side that we are supporting, that our solutions and tools are designed and developed to support them directly, right? So that we're staying on top of all those regulatory and measurement requirements. So that's kind of what I do in a nutshell here. And I do really like to geek out on member engagement, digital engagement again. So this should be a great conversation. I'm excited to be here. Thank you.
Awesome. Well, that's great. Thank you for giving us a little intro. And so we're going to be diving into, I guess, digital engagement, empowering members and members. Can you tell us a little bit about just that? I know when I heard you do your intro, I was like, 1 billion. Wow. So you are the right person for this.
Yeah, I don't know if there's anyone out there that's doing more. If so, I'd be interested to hear more about that. But yeah, so digital engagement, what we do is we are an omni-channel organization. So we are talking SMS, two-way SMS, one-way SMS, IVR, email. We do have some print functionality, but understanding that in this engagement space, we have different users, different channels, different preferences. Not every message is required to be delivered in a certain way, right? Or people have preferences. So yes, we deliver over 1 billion messages annually on our platform. And our sweet spot really, Michael, is our two-way SMS. So we have some patented and proprietary technology in that space. And that's the stuff that I get really excited about. All of the communications that we put out, are built and designed with a large team of content writers, adult educators, behavioral scientists, et cetera. But this two-way space is really where we see a lot of really sweet stuff coming in, going out, and then coming back in, bi-directionally from the members as well.
I love this because I feel like SMS is like a source of truth. And why I say that is my mom is 86. No one had to teach her really how to text, right? She can't do an app, or very limited, let's say, but SMS makes sense. It's very native to agnostic demographics. And so I'd love for you to dive into just the delighting in that kind of let's just go on it.
Yeah. So you think of, I like to, I pay close attention to messages I get from other organizations, healthcare as well. Because I'm always curious, like what's out there and how would I act or react? And we take that into practice as well. But let's think of two-way SMS. And a lot of the work that we do is around quality improvement initiatives, helping folks get preventive screenings, managing chronic conditions, that sort of thing. So it would be, hey, Reva, you're due for an X screening. Click this link to schedule or call here, for an appointment, et cetera. You can deliver those messages via phone, direct outbound calls. Those are expensive. Live agent calls are a great way to communicate with folks, but they're expensive. They're not as easily scalable. And then our outbound IVR calls are great and work really well actually in some of our senior demographics, but we'll stick on that two-way SMS. And what I think is the delight part of it is that you're able to get that message, you're able to get that call to action out and delivered to the individual. And let's say it's 2 o'clock and I'm at the grocery store, which I'm not because I should be working at mPulse, right? But let's just say it's 2 o'clock, I'm at the grocery store and my health plan is going to text me and ask me to do something. Hey, you have a benefit, you have a thing you have to do or you should do or whatever the message might be. But this is not I wouldn't pick up the phone and say, oh, hey, health plan, sure, let's talk about this because I'm in the middle of something else. But what I'm able to do is still have that really rich, meaningful message and even communication. And then I can act and interact with it when the time is right for me. And I haven't been lost because I didn't pick up the phone, right? So we're able to see, really great reach rates in that space. We're able to learn and we work with, like I said, over 200 plus healthcare organizations across the entire United States. So what I like to see and kind of geek out on is some of the data that comes back in from that, where we can see across multiple states, across multiple age bands, genders, other types of demographics, what's working, what's happening. We see that, a certain percentage of folks are going to pick up messages or they're going to reply to them more often on Tuesday, Wednesday, and Thursday, not Monday and Friday, right? We don't want to hit them right at mealtime. And those are notions and things that are kind of like best practice in communications. But us being able to see that data and see the action and the reaction based on our messages across such a wide expanse is just incredibly valuable, because then we can say back to our health plan clients, this is what you should say and when you should say it. And it's not because we think so, it's because we know so, because we see the data, we see the action. We see that if we send a message, for example, we have some prescription refill solutions that we run with some clients. And the data is telling us that refills happen within 4 days of that first message. 70% of the people are refilling after only one message. So that's really great. So then that's also telling us, hey, if someone doesn't complete the refill, or I need to check back in with them, I should wait at least 3 or 4 days, because it's going to take that long for someone to see the message, react to it, act on it, take action, whatever it might be, right? So that's the stuff that I think is really exciting to be able to see. And even just when we think of communications too, like how many times do you get messages and people just miss the mark, right? Like, you love the free form where your name is in all caps. It's like, Reva. I'm like, come on, the rest of it's in. That's not hard to do. Like, I'm not a real technical person, but I can manage that function in Excel. But you miss opportunity, right? And we think about healthcare. It's behind the times a little bit compared to other, businesses and organizations and consumer type folks. And I think that's probably okay for one sense, to think of like, these are people and these are things that we really need to protect more than Neiman Marcus texting me that, hey, there's handbags on sale or something, right? So we need to be careful. So it's okay to be a little bit slower in adopting, I think, some of these, more technology-based trends, but really just building that brand awareness, brand reinforcement, digital trust, right? If you're going to send a message, make it a good message, make it relevant, make it important, make it mean something to me. And that's, I think, what we're really seeing as moving the needle. It's getting more people to act and to react and to do things when you're able to send something that means something to somebody, right? And you're doing a good job. So if you're sending me quality messages, making it easy to do, I don't have to necessarily jump through a bunch of hoops or, switch out of this channel into an application, which of course does work in some instances and has use cases, there as well. But then I'm going to build trust. Then the next time you text me or message me, I'm going to know who you are. Hopefully I've stored your number in my phone, and I'm going to then be more willing and more compliant, because we're building that trust of sending solid and quality messages.
Can you share a little more about the digital engagement? What I have below, I have trouble right now reading with my glasses off. So if you could help me just take that and run with it. And I'm seeing engagement, better conversations. Forgive me, I'm not seeing all of it. My eyes are not being helped by my lack of glasses. So
that's all right. I don't have mine on either, because I think all you would see is a little, ring camera circles there. But what we're saying here is, what are we seeing coming out of health plans as our primary clients. So what is mPulse doing? How are we using technology and digital engagement to tailor conversations and communications at the personal level? So like I was just saying a little bit before, right? It has to be relevant. It has to mean something to me. So I mentioned that, we have a whole team of super sharp and smart people that help us deliver our messages. But behavioral science, use things like loss aversion. We've got some interesting solutions where, we're trying to encourage folks that are diabetic to get an eye exam. And people will say, and because we get these responses in this two-way SMS space, my vision's fine, I don't need an eye exam. Well, we're looking at retinopathy here, which is a result of uncontrolled diabetes or a potential risk or complication, if you will. So we're able to use streaming content. So think of that as like Reels and TikToks, right? Like hopefully we'll gain as much traction as those things do in the healthcare space eventually. But we're able to then respond. So if someone, my health plan messages me and I'm diabetic and they're encouraging me to get an eye exam. And I say, no, my vision's fine, which we just said it wasn't, right? No, my vision's fine. I don't need one. I'm good. Our technology is able to understand that and then reply in a very meaningful way to that person's response. We're going to give them this video, this short 60-second clip, right? And it's actually a personal, your own personal view, if you will, of someone riding a bike or going at a soccer game or hanging out with grandchildren. And it's putting should have just shown it, but do justice by explaining. It's overlaying on the screen what cataracts might look like. So it's, as you can imagine, it's blurry, what retinopathy looks like. So what glaucoma looks like. So it's giving someone an idea of like, hey, we're not talking about wearing glasses, getting our eyes checked vision here. We're saying that if you don't get this really important exam, these are some of the potentials, or this is some of the risks. So we're using that loss aversion. You don't want to lose your sight or lose the ability to see your grandkids, right? And so we've seen some really great movement in those, using those types of means of communication and educational content, if you will. But when we talk about tailoring, I think going back to even my health plan days, and I think we did a great job where I was. I think we did a really good job of, understanding our member populations, their diversity the best we can. But it was hard to then turn all of that information and that data into personalized, meaningful conversations. You need the help of someone, right? You need the help of someone like an mPulse who's able to do that at scale. So let's say, for example, we'll stay on the diabetes story. This is one of my favorites. We need to have someone get an A1C. So their blood sugar needs to be checked, right, annually. And for the health plan, they're looking at an ideal rating. So they need that person to be within range. If I have an entire group of members that need to have this screening, I should look at other things about them. I should look at other characteristics about those diabetics, let's say. So we would take some and say, all right, this group over here has filled some medication this year. They might not be the most adherent, but they've filled some medication. This group here has been seen by the doctor once, but maybe they're still out of range. Or this group here hasn't done anything. They haven't been seen in a year. We have no data on them. We have no good readings for A1C. Those individual folks or individual buckets or populations of people are going to require different communications. They're going to require different types of outreach. That first group who's been to the doctor and filled some medication, I can probably send them a pretty simple nudge message saying, hey, Reva, you should go get your blood sugar checked. Here's a link to schedule, or here's type in your zip code. This is the closest facility near you in your network, whatever it might be. And then she's going to go and have the blood drawn, and it's probably going to end up in a good result, right? We move forward over to that other group who hasn't been seen at all and hasn't done any of the things to help manage their conditions. They're going to need more. They might need more of that educational content. They're going to need more of that maybe behavioral science of, hey, this is why you should do it. This is what's good for you. They're going to need more of a connection to clinical resources. Is it care management, case management, right? Because they're clearly not responding to other normal, I don't say normal, but routine communications or cues of how to manage your health. So it's being able to use digital channels. What I like to see is, say, like I said, we have this entire group of people that need something, or they need to do something for themselves also, right? It's not just for the health plan. But what do we know and what can we learn and we already know about them? And then deliver really important and personalized messages to them. And you're going to get a way better or bigger lift, almost every single time.
Well, I love how you've laid it out. And when you think about the 168 hours in the week, or how many, if you go to the clinic one day, or, let's say on average, depending on the population, right? The data, maybe it's 2 to 3 times a month or more chronic care patients. Maybe they're going to the doctor twice a week. I don't know, depending on whatever the comorbidities are, but still there's so much education, so much loss. So it seems like the way you're delivering it with that data, with the behavior science, you're really, I guess what you would call it, really filling in the gaps of care, delivering that patient experience for those doctors and providers. So it seems like no wonder you get excited, because the sky is the limit. Because if you're a clinician or a doctor, there's only but so much. You got 15 minutes, right? You got 15 minutes with that patient or member, and so you're the eyes and ears of everything else. So I love it.
Yeah, it's great. And I think if that your point, you've got 15 minutes, and how often when you go, and I don't, thankfully I'm relatively healthy, so I don't go multiple times a month or a quarter even, but how often, even having established primary care, do you see the nurse practitioner this day, or the family nurse this day, or maybe the DO or MD another day, right? And they're probably not all like coordinating, hey, last time I saw Reva, I learned this about her, so she needs something else, right? They are doing the best they can with what is available to them. So I think being able to work obviously in tandem with the general efforts of getting people in and getting people seen and helping connect them to care is, really what we're trying to do. And I know I kind of talk about like controlled A1C or non-controlled A1C, but anyone that we can get to move into an office visit, into a telehealth visit, connecting with case management, that's when the things start to really happen, right? Digital engagement's only a piece, and yes, we can help drive and complete that call to action or close that gap. But it's really the bigger picture, how I see it, of you're getting the people what they need. You're getting the people what they pay for. They're paying premiums every single month. You may as well get the most out of it. And then you're also, I'm a perpetual optimist, which drives my husband absolutely crazy. But then everybody else gets to do what they're supposed to do.
You're in the right profession, right? Because you're never.
If I can help get the person in the door,
then
the rest of the workflow can do what it's intended to do. The rest of the communications and appointment scheduling and follow up, then those things kind of start to fall into place, I think.
But I think also you're in the right area with the customer delight, because you're never going to find that. It's like you're achieving constant process improvement, trying to improve that. So I love, that's what I'm hearing, like with the data points, everything you can do to make this better. And when I'm hearing about your solution and what you're sharing, where does it that the other points of influence, like the care team, come in? I'm hearing the SMS from, I guess, let's say the insurer or the payer to the member, but what about where that care manager comes in? Tell us about those different points, because that to me seems where you start getting some stickiness. And maybe I'm putting something out there that shouldn't, but if there's something like that, or you can share if there is, that would be awesome.
Yeah, absolutely. So understanding that is an important piece, right, of a lot of the puzzle. We look at duals, at D-SNP contracts. So those dual eligible members are eligible for Medicare and Medicaid, and they've now enrolled in a special Medicare Advantage plan for them. Each one of those members is assigned a case manager. In other space, you look at folks that are typically going to get into case management when they have multiple chronic conditions or have hit a certain number or dollar of medical spend or trend for the year, or referrals, right? Or they've had a level of care change. So it's not everybody, but we look at a lot of folks that I used to, like in my outbound team that I ran at my health plan. A lot of people need a lot more, but they don't qualify for this next level of care management or case management. So how can we kind of fill that gap? But I think to answer your question, it always depends upon, the health plan or the buyer, the person who's coming to us for help. But we understand that landscape in general. and understand that only certain things maybe can happen in this transactional space. And I know I'm talking a lot about two-way SMS, and there's other means of conversation, but that's, like I said, where we see really, really good stuff. So we have technology that's available to integrate into other systems. So into other, CS, customer service modules, CRMs, integrate into case management. We have our own tool that you can use where, let's say I'm going to send a mass message to all those diabetic folks that we think are going to go get the A1C reading, right? And most of them will go do the thing, and we can handle those conversations in automation. But some of the people that may fall through, right, and end up at the end of this tailored conversation that we've planned for them, we're able to pass that person, if you will, off to care management or a clinical team or CSR at the health plan, all within the same thread, right? The number isn't changing, the short code isn't changing. So that conversation is seamless. The initial automated part is happening, but then we can pass through the technology available to us, that person into the hands of someone who's at a computer, who's typing a message, but all within the same thread. So it is a seamless experience, right? So we do a fair amount of that. We also similar capabilities with community health workers. So people that are out on the street, boots on the ground, if you will, and they're able to do the same thing. Like, I'm going to text you and say, I'm turning up at your house at 3:00 today. You're going to be there, and they can have real-time conversations with those individuals to help connect them to care, really. And that care can be care management. It can be a link to find a new provider or find a pharmacy closest to you or whatever it might be. Whatever that
or to give them a TikTok video of what they need to know to understand that, right? Yeah. So what are tell us some more about these trends that you're seeing in digital communications.
Yeah, absolutely. So outside of, just the general technology of being able to reach someone on a device or in their hand or whatever it might be, we're really taking inspiration from, leading brands in the industry to engage and to engage and empower people, right? So we are using these TikToks, these reels, we call it streaming health education. And I don't know if you know that there is still an awful lot of medical type information out in the TikTok space. So people are going there and watching these, medical professionals are doing, talking about conditions or procedures or whatever it might be. So it's kind of like, don't WebMD your condition or Google your condition, right? It's there. But anyway, we look at it as an educational space. So go back to that 15 minutes in the doctor's office. They do not have the time to tell you all the things you might need to know. Or maybe you've been told 6 ways to Sunday every time you go into the office: eat better, exercise, reduce your salt intake or something of that sort, right? If you've got cardiovascular disease or hypertension, whatever it might be. It's okay, you've told me over and over and over again. But if I can watch a video of someone who looks like me, who talks like me, who has, fits kind of the same demographic type mold as me, and is going through, hey, this is an easy way to prepare a meal with simple ingredients, or understanding that we have folks that may live in food deserts. They have areas where really healthy food isn't readily available. So then what do we do? Or we can't just say, to individuals, if we're talking about cardiovascular disease and healthy eating, don't eat red meat. There are groups of individuals who don't for religious and cultural reasons. So we want to be sensitive to that. So being able to use this streaming health content is just such an exciting and empowering way to give someone information in a way that they've never seen it before. Okay, right? So if my 60-year-old family physician keeps telling me the same thing over and over again, I say that because I'm not 60 yet, right? No offense to 60-year-olds.
Yeah.
But I want to hear something from someone that I can relate to, from someone who can share an experience that's similar to mine. Then that's going to connect. It's going to resonate, right? So that's really what we're seeing. And we also are using a lot of photonovellas. So those comic strips, or those reels, not reels, but the comic strips. And that's a simple way to give someone a visual. We also understand, like, healthcare is hard, man. Like, I feel like I'm pretty savvy, but every week I have, an instance within my family of getting my kid to the well child visitor where there's something like, this shouldn't be that hard.
Yeah.
Or you be your own advocate. And I think of the folks that aren't at that level of understanding in healthcare, like we are, and it's got to be even harder for them. So how can we bridge those gaps, the educational gaps, language gaps, barriers, et cetera?
I feel like we some of the stuff I wish I would have been able to pull some videos and it's such a visual experience that you're talking about. And I guess maybe for next time, but if there was something you have access to, a link, I might be able to put on. I don't want to, I know it's on the fly, but I feel like a lot of the things we could show, it's more like, just the visuals of it. So,
absolutely. So, and not to be with my mPulse mug, shameless plug here. But if you go to our
put
website,
it up a little more so people.
mPulsemobile.com. You go to our website, and I'm happy to drop the link here too. And you can see some of this stuff in action. So we recently had a JMIR study published that we ran with a client to increase their colon cancer screening rate. So we had a control group. And then the other group that received SMS and this digital photonovela. So what the photonovela is it's individuals that look like you, that you can relate to, and they're having a conversation with each other about like, I don't think I need to have that. I'm only this old, or I don't have a family history. And it's two people having a conversation. And then it's one person maybe saying, I don't remember the specifics of that one, I should, saying, oh, well, did you know that you can have an in-home test done? You don't actually have to have a colonoscopy or go do that, right? There are other ways that you can screen for this. Or did you know that if caught earlier, it's relatable, or it's saying my Uncle Joe had this happen. And people are able to see that conversation unfold in a visual space. And of course, at the end, it always ends with the person doing whatever the main objective was, right? We get them to but asking in a conversational space, which most people probably would, right? I have, was talking to a family friend the other day who was saying that.
Well, I feel like I'm totally interrupting, but I feel like what you're saying is you are doing a real good job because everything's word of mouth. You talk to your family, your friend when you make a decision. So the photo novella, whatever comic thing is, you're almost like trying to get that engagement as close as you can to word of mouth, relatable. So I think from a psychological thing, that's how I see it, to the person who doesn't know mPulse and all your science, but it's like you ask a friend. So you're really creating those, making it accessible for people.
Right. 100%. And I think, we're just talking to a family friend last weekend, and they were saying, my doctors told me time and time again, I got to go get the colonoscopy. And it wasn't until my wife saw a commercial for something and was like, you need to go do it. And so sure enough, he did it, but he had been told multiple times by someone else. Right. So it's really kind of trying to make that relatable and bring other people into the conversation, because who's the trusted source in some families? The wife, the mom. She's probably the one that does a lot of the scheduling and whatever. Right. So it's bringing other people too, I think, into that conversation, or really just making it relatable to say, oh, yeah, actually, I have had a conversation similar to that with someone. And then I realized that this is the action I should take, or the thing I should do. So
where do you see this going in the next few years? Where's the future of this? What do you think, as you see engagement, patient engagement, member engagement? I know that varies, depend on the actual customer, but tell us where you see things going. What would you like to see?
Yeah, I think we would like to see, more digital adoption, more, I don't say digital adoption, it's such a broad term. Like, I think it would be nice to see more of this content. We have the ability, and we as in general, we within the healthcare landscape know a lot of things and have access to a lot of data on all of the people, right? So we can know based on a lot of different factors what different demographics you may fall into, or even if we're getting down to self-reported, which is the gold standard. What's your preferred language? But there's I think problems there in the sense that there's no standard data capture in healthcare. I think CMS just put preferred language and maybe race, ethnicity on their enrollment forms a few years ago, but it's not a requirement. So I look at it as like, hey, A for effort. Thanks for at least trying to standardize some collection, right? But when we can work together across technology, especially healthcare technology, and really understand the differences in our populations, and use things like photonovellas, streaming content, two-way SMS, maybe it's email, whatever it might be, when we can use it and be smart about it, I always say, is better an option? And I ask this to my kids sometimes, and she'll kind of roll her eyes like, yes. Well, better is an option, then that's your answer. You have to do better. We have the ability, I think across healthcare to do better and to work together from the payer side, the provider, the vendor, the service folks, to really work together to do better. I was thinking coming into this today that if and when we do make it to Mars, I hope we do healthcare right from the start, like right from day one. From the first moment, everybody's covered. There's, everyone understands all of the things, and you get all of the great benefits. And so,
Well, there will not be pre-authorizations in Mars.
That is good. That's good.
Yeah.
What about what does the FDA approvals look like on Mars?
I think there's it's still in flight.
Pun intended.
Yeah, I guess. I don't know. But anyway, I think what I would like to hear, because you're an eternal optimist, right? I love it. Especially in your customer delight, that's sort of where your mind is, and improving processes, making things better. But what are the blockers? What are the challenges in this space? Because healthcare is still so annoying, right? It's so frustrating. And when I mean that, like, perfect example, just using myself as a parent or, an adult, you call the doctor and, we only do some same day if you don't schedule 3 months in advance, and call tomorrow at 8 if you can get in, or whatever. It's just like, are you kidding me? No calendar. So there's so many of these things where it's just the phone. There's no back and forth. So I'm just saying a little bit of my little experience just as a parent or adult in healthcare trying to get an appointment. So what are the big barriers you're seeing, the big picture barriers?
Yeah, so I mean, we know that there are access issues, right? Not everyone has a telephone or a smartphone. Not everyone has great broadband, but I think that we can start to solve for some of those issues, right, by getting subsidies in the hands of folks that should apply for a subsidy to have subsidized broadband, or to have, health plans. We see some groups that are actually giving smartphones or iPads to their members so that they can communicate. If you have someone in a rural space, but we're able to help make sure they have broadband and they have a device where they can connect with a clinician, or even if it's remote monitoring devices where clinical data can be exchanged safely and securely to that care team, you now have a way to access and reach someone who otherwise would have a lot of trouble getting care or getting the help that they need. Medicare actually just released, or CMS just released yesterday, their current beneficiary survey. So every year they survey a number of current beneficiaries, and it could be fee for service or Medicare Advantage, but they're basically asking them, do you have access to broadband? And it's yes. So I just wrote the stat down. I don't know it by heart yet. 89% of the beneficiaries surveyed in 2022 said yes, they do have internet access in their home. They go so far to not only then say, do you have access, but what are you using it for? Over 50% say they use it to find information daily, and over 75% are using it or 62% are using it to look up health information, right? That's huge. They're using the internet. Hopefully it's something better than no offense to WebMD, but you shouldn't Google your conditions, right? If you think something might be wrong with you, you should use the internet to find the nearest or the best appropriate care near you and connect to that, right? 40-something% are using it for doctor visit, for telehealth type visits, which is great. 40-something% is huge. I'd have to go back now. I'm curious to see how much lower that was pre-pandemic, because I think people were kind of forced.
Yeah. No, you're right. You're right.
Using things that they were like, oh, I don't need a virtual visit. I see my doctor every once in a while, or however often. Well, what happens on a Saturday evening if you think you have a sinus infection and it's 9:30 in Grand Rapids where I'm at? Guess what's open? Hospital downtown. Is that the best place for me? Yeah. No. But now I understand, and now I know that I have access to these other things, these other resources, or if it's telehealth, for an example, right, where we want to connect people. And this is kind of back to some of that behavioral science. These things have been around forever. There were virtual visits available well before COVID. When I worked in the Medicare quality space, we would go out and do member road shows. We'd go do across the entire state of Michigan, and we'd go visit with our members and say, hey, here are all of the things, and this is what you would use them for. And people were like, oh, wow, what a great idea. And here we thought we had done a good job of explaining the benefits. You give them the book that has all of the things in it, right? But they're not putting those two to two together because you're not giving them real life or realistic situations or scenarios of this is when you would use this, right? So I think looking at challenges, we have access is still a challenge, of course, and we have ways and means to help overcome some of that, especially for those that might need it the most. But I think that we would be great to see more coming out of our governing bodies or regulatory space. For example, Medicaid redetermination, right, was all on pause during the unwind or during the public health emergency. Well, now we're back into redetermination, so folks have to reapply for their coverage in a lot of cases. So the FCC put out a declaratory ruling back in January of this year saying the provision of a phone number on an enrollment form, on a Medicaid enrollment form, constitutes consent to be contacted for this purpose. And we were all like, yes, like what a huge win. Like sure for us on a business point of view, but what a huge win on this subject matter when we know we have millions and millions of people who've never gone through the redetermination process. We have people who have moved, people who need to update their contact information. And this is a great way to use technology to reach those people to make sure they get to keep their care. They get to keep their benefits if they still qualify. And if they don't, we can now use this channel to move them to a marketplace plan or something else that they may then qualify for. So it's stuff like that that gives me hope. That's maybe setting a precedent, for moving forward to say then, okay, well, if the provision of a phone number on an enrollment form allows me to reach out to you to make sure you can get into your primary care provider.
Yeah.
So looking at even that advance notice I mentioned, there's a lot of kind of scrutiny around supplemental benefits for Medicare Advantage. So that's enhanced vision, dental, hearing, those types of things. So CMS wants to make sure that plans aren't just creating these things as come buy my plan, it's super fancy and attractive, but that the plans are actually making good on those benefits. So they propose, we'll see what happens, that health plans are required to reach out to their members mid-year to those that haven't used those benefits and say, here's the list of things that you have not used. Reva, you did not use your gym membership, you did not get your eye exam, or you didn't use any of these things, right? So I think looking forward at some of these things of understanding how do we help get the right things into the right hands of the right people and making sure that folks are getting, really the most bang for their buck. So those are some of the challenges we see, I think, in some of that space in general of how do you get to the people? You got to make sure you give them the right information. It's kind of like the triple aim, which is now the quadruple aim or something, right? It's the right care, the right time, the right place. Same with messaging. It's got to be the right channel, the right information, the thing that makes the most sense to that end user.
We've talked about delight, engagement, but I think empathy. I'm feeling empathy in this, that you're really empathizing with the journey. And when you're, I don't know, I'm just so glad that we had you on. I've learned so much. There's so many layers that you've unpacked. And I really like what you said, like on a scalability, like this re-enrollment. I'm probably using the wrong word, but you have all these members, redetermination, I guess you use, that otherwise would be talking about they would lose out on their health care, right? They would not then be able to reapply to whether it be Medicare or their Medicare Advantage or however correct. I mean, they're just lost in the shuffle. Is that correct, kind of, in a sense?
Correct. So if I wasn't able to reach out to you, maybe you're, via phone or digital means without you getting prior consent, how am I going to get consent if I can't get to you? I'm not going to know that you've moved until your mail comes back to my mail house and says she doesn't live here anymore. At that point, now what happens, right? Now maybe you've gone to seeing a provider, and then you get probably not a bill in the mail if you've moved, or you no longer have care, or you go to the pharmacy and like, I'm sorry, your card doesn't work anymore. And you're like, but what am I supposed to do? We want to try to avoid that. And yes, empathy, I think, even when we look at the quality landscape from Medicare Advantage and there's star ratings and there's, millions of dollars tied to that go back into the health plan. And those plans are using those dollars to reinforce those benefits for the members, right? If we have high performing plans where everyone's getting their preventive screenings, our diabetics are well managed and well controlled, that's happier and healthier populations. That's happier and healthier grandparents and neighbors. That's how I see it. And the more we can continue that, sure, there's a financial incentive there, but then that's incentive for the plan to continue to invest in taking better care of their members, taking better care of those folks that need it the most. We don't have to raise prices. We don't have to cut supplemental benefits. We can make sure that people get the things that they need. So that's really where I see the excitement coming from. Like, sure, we do a lot of great gap closure work and strong call to action and completion rates for things. And that's amazing because we're looking at, performance, but really seeing the full picture of how it impacts the end user. And the end user really is all of us that have healthcare of any one, kind of or another. That's the people who matter. That's the people who count.
Well, Reva, I'm so glad you came to Earth today here and we're not on Mars yet, and just stopped to just share with us. And I know we're kind of coming towards the latter part of our time. Is there anything that has kind of come up as we've been talking that you think you'd like to share more about?
Gosh, that's tough. I could probably, those of you that are listening that know me, I can talk about stars and quality and engagement all day long till I'm blue in the face. But I think just going back to reinforce that is better an option, right? Better is an option. And sometimes it doesn't have to be that hard. It doesn't have to be this huge, daunting task, right? Or we know that we're not going to get to Mars overnight. It's going to be a longitudinal effort. We're not going to get to super great healthcare overnight. But I think that the people that are working in this space to stay motivated and stay empowered and stay connected through, means like this here at Michael too, I think is just really great, because I think we're all in it for the same reason. And even just like little tiny baby steps and incremental movement to do better, to do right, by the individuals that we all effectively serve. That's what's going to get us to Mars or get us to that great, healthcare space in the United States.
Well, this has been great. Reva, how should people get in touch with you? How do you want to, I know you're on LinkedIn. What would be a good way to kind of give people, to find you, or how should they come across you?
Sure. Yeah. So LinkedIn's a great spot. Go ahead and shoot me a message, send me a connection. I'm always happy to have conversations as well. Like I said before, you can go to mPulseMobile.com. We have a bunch of different, kind of widgets on there where you can connect either directly with me. You can schedule time on my calendar. You could also email me if you want. You can see my name right here. Just put a dot in between the Reva and Sheehan, and the rest is at mPulseMobile.com. Or reach out to our friend Michael, and I'm sure he can help link us together. So thank you.
Yeah, I would more than happy, and I'll make sure you're good people too, because you never know, right? So anyway, of course. So anyway, we're wrapping it up today.
Thank you.
Friends, it has been a great journey today on Planetary Health First, Mars Next. Follow us for more on Planetary Health First, Mars Next. Until next time, peace be with you.